In the next few minutes, I'll show you how changing one simple habit could help you feel more pleasure, more confidence, and more control over your body than you've felt in years. Hi, I'm Dr. Michael Bennett. And if you're a man over 60, still pleasuring yourself the same way you did at 20, I want to speak directly to you. Because I've seen it. Time and time again, men come into my office proud of their routines. Some say, "Doc, I've still got it." And I love that energy. But then, when we dig a little deeper, they start to notice things they've brushed off for years. A duller climax, less sensation, erections that just aren't the same. And suddenly, what felt harmless turns out to be something that's been slowly, silently taking their confidence away. Let me be clear. Masturbation isn't the problem. How we do it, that's what matters. Especially as we age. You see, after 60, your body isn't quite the same machine it was in your younger years. And that's not a failure. It's biology. Your skin becomes thinner, your blood vessels more delicate. The fine nerves that once lit up with pleasure now need a bit more care. And your prostate, it's no longer just a quiet background player. It reacts, it signals, and if you don't listen, it starts to protest. Now, no one teaches us this, do they? We're told masturbation is normal, healthy, even necessary for men. And it can be, but only when it's done with awareness, respect, and an understanding of how your body has evolved. That's why I created this video and this entire series. Not to judge, not to shame, but to give you back something most older men were never handed. The truth. Over the next few episodes, I'll walk you through 7 of the most common and most damaging mistakes I see men over 60 making when they masturbate. These habits don't just affect your erections or your pleasure. They influence your sense of masculinity, your confidence, and your connection with your own body. You're not broken. You're not too late. You've just never been shown how to adapt. Think of it like this. You wouldn't treat a classic car the same way you'd treat a brand new sports model. A classic requires care, the right touch, the right fuel. And when you honor it, it rewards you with a smoother ride than you ever thought possible. Your body is no different. So before we dive into mistake number 1, I want to ask you something. What would it feel like to reclaim that spark? To wake up feeling alive again? Not just in your mind, but in your body? Stick with me. You're going to learn things no one ever taught us. Things that could change the way you feel about yourself, starting today. Ready? Let's begin. Welcome back. I'm Dr. Michael Bennett, and today we're diving into the very first and possibly most damaging mistake I see older men make when they masturbate. It's something I call the death grip. Now, I know that sounds dramatic, but once you understand what it is and what it's doing to your body, I think you'll agree it's an accurate name. The death grip refers to using too much pressure when you masturbate. I'm talking about squeezing tightly, stroking quickly, applying force like you're trying to make something happen fast. Maybe it worked fine when you were younger. Maybe that was even the only way you could finish during stressful times. But here's the truth. After 60, your penis isn't built to handle that kind of pressure anymore. Over the past decades, I've had so many men, veterans, teachers, businessmen, retirees, come into my office feeling frustrated. They'd say, "Doc, I can't feel anything anymore." Or, "I climax, but it's dull, flat, like something's missing." And every time, I ask them the same simple question. "Can you show me exactly how you've been stimulating yourself?" Most pause. Then they mimic it. And 9 out of 10 times, they're gripping way too tight. Here's what happens when you do that repeatedly. The fine nerve endings responsible for sensation, those delicate fibers right under the surface, start getting damaged. Your blood flow gets restricted. Over time, you develop micro tears in the skin and even in the deeper tissues. Some men eventually develop internal scarring. Others, sadly, lose sensitivity altogether. I've seen cases where the penis even begins to shrink slightly, not from age, but from the cumulative trauma of overly aggressive stimulation. In more severe situations, the trauma causes Peyronie's disease, which leads to painful curvature. And the hardest part is, most men had no idea they were doing it to themselves. So let me be the one to say this. You don't need to fight your way to pleasure. You need to listen to your body and treat it like something worth protecting. Here's what I recommend instead. Soften your grip. Imagine you're holding a bird, not a hammer. Use lubrication every time. It reduces friction and protects your skin. Slow down your rhythm. Give your body time to respond naturally. Stay present. Breathe, feel, and reconnect with sensation. Your pleasure shouldn't come at the cost of your sensitivity. Not now. Every stroke matters more at this stage of life, and every adjustment you make now can help you preserve what matters most. You're not losing your ability to feel. You just need to stop numbing it. Welcome back. I'm Dr. Michael Bennett, and in this part of our journey together, we're going to talk about something that may seem small, but can cause a world of discomfort over time: masturbating without lubrication. Now I know, if you've been doing it dry for decades, this might sound unnecessary. Some men even say, "I've never needed lube in my life, doc." But I want to gently challenge that thinking. Because after 60, your skin is not what it used to be. The protective layer becomes thinner, more fragile, and your body doesn't bounce back the way it once did. Every time you stroke without lubrication, you're creating tiny friction burns, microabrasions that may not hurt in the moment, but that build up over time. I had a patient, 72 years old, retired, still sexually active, and doing fairly well overall, but he came in feeling irritated, slight burning. Something just felt off down there. He thought it might be an infection, but after some careful questions, the real issue became clear. He had been masturbating dry for decades, no lubricant, just skin on skin every time, and now his body had had enough. Dry masturbation isn't always painful right away, but the effects are cumulative. Over time, it can lead to irritation, inflammation, thickened skin, and a noticeable loss of sensitivity. Some men begin to feel like their shaft is tighter, rougher, or less responsive, and they chalk it up to aging, but the truth is, that's not just aging, that's damage. Here's what's happening inside. Constant friction wears down the outer skin layer, reduces elasticity, and can cause scar tissue to form beneath the surface. Once that happens, the penis becomes less flexible, less sensitive, and more vulnerable to injury. And when the skin is inflamed, blood flow gets restricted. That can make it harder to maintain an erection and reduce the pleasure you feel during orgasm. The solution is simple. Use lubricant every single time. Whether it's water-based or silicone-based, consistency is what matters. Lubrication protects your skin, reduces friction, and allows for smoother, more natural movement. At this stage of life, it's not a luxury, it's a necessity. So if you've been skipping the lube, I encourage you to rethink that habit. It might seem like a small change, but it can make a big difference in your long-term comfort and pleasure. You've earned the right to feel good in your body, without pain, without risk, and without losing touch with what makes you feel alive. Next, we'll go even deeper. Because while the skin is the surface, your prostate is the core, and ignoring what it's trying to tell you could cost you more than you realize. Until then, stay gentle with yourself. Welcome back. I'm Dr. Michael Bennett, and today we're going to talk about a part of your body that most men never think about until it starts demanding attention: your prostate. Now, you might be wondering, what does the prostate have to do with masturbation? The answer is, more than most men realize. Over the years, I've had dozens of older men come to me with vague, uncomfortable symptoms they couldn't explain. They'd say things like, "Doc, I get this dull ache between my legs after I climax," or "There's this weird pressure behind my testicles." Some even said, "It burns when I pee, but there's no infection." Many of them thought it was just old age. But the truth is, these are warning signs from your prostate, and they're often ignored for far too long. Here's what's really happening. Your prostate is a small gland, but it plays a big role. It produces most of the fluid in your semen and is closely connected to the nerves and blood vessels involved in erections. And just like every other part of your body, it becomes more sensitive with age. When you masturbate too frequently, too forcefully, or without giving yourself time to recover, your prostate can become congested, overworked, and inflamed. This condition is called prostatitis, and while it's common, it's also deeply uncomfortable. And here's the kicker: most of the time, it's completely preventable. Let me give you an example. A man in his late 60s came to me complaining of post-ejaculation pain and a constant urge to urinate. We ran all the usual tests. No infection, no enlarged prostate, nothing obvious. But when I asked about his habits, he admitted to masturbating every day, sometimes twice, always quickly, and never paying attention to how his body felt afterward. That was the clue. His body had been shouting for rest, and he hadn't been listening. Masturbation isn't supposed to hurt. It's not supposed to leave you feeling pressure, burning, or incomplete. If it does, your prostate is likely trying to say, hey, I need a break. So what can you do? First, slow down. You don't need to climax every time. Second, give yourself recovery time, especially if you've been feeling discomfort afterward. And most importantly, pay attention. Listen to what your body is trying to tell you. Remember, the prostate is not the enemy. It's your partner in pleasure, and it deserves just as much care as your heart, your lungs, or your brain. Now pause for a moment and ask yourself, have you been ignoring the signals? If any of this sounds familiar, just know you're not alone. There's no shame in learning late. The only mistake is not learning at all. Welcome back, it's Dr. Michael Bennett. So far we've talked about your grip, your skin, and your prostate. But today we're going deeper into the one place most men overlook when it comes to their sexual health, your brain. Let's talk about what happens when you watch high-stimulation porn too often. Now I want to be clear, this isn't about shame. I'm not here to judge what you watch or how you spend your time. I'm here to help you understand what years of certain habits might be doing to your ability to feel real pleasure with a real person, or even just with your own body. Over the past few decades, I've had more and more men tell me the same story. Doc, I can perform just fine when I'm alone, but when I'm with my partner, nothing happens. Or, I used to feel excited and alive, now I just feel flat. And almost every time, we uncover the same pattern, long-term, high-frequency porn use. See, your brain is an incredible machine. It adapts, it learns. But that also means it gets conditioned. And when you constantly feed it a flood of ultra-stimulating, fast-paced, hyper-intense sexual content, your brain starts to respond more to the screen than to real life. Your dopamine levels spike with novelty. Your reward system rewires. Over time, your brain learns, this is what turns me on. And unfortunately, real intimacy, with its imperfections, slower rhythm, and emotional nuance, starts to feel less exciting. It's not that you've lost your desire. It's that your brain has been hijacked by intensity. I've seen men in their 60s, 70s, even 80s, who still have the physical ability, but they can't get aroused without a screen. That's heartbreaking. But it's not hopeless. Here's what I want you to know. You can retrain your brain. You can take back control by taking intentional breaks from porn, masturbating without visual stimulation, reconnecting with sensation, breathing, rhythm, and presence, and creating space for real, grounded connection, alone or with a partner. This won't change overnight. But it will change. You are not broken. You are rewiring. And just like training a muscle, it takes time and patience. If this speaks to you, if something deep inside is nodding and saying, this might be me, you're not alone, and you're not too late. Now, if these insights are starting to resonate with you, and you'd like to keep learning more about natural ways to restore your energy, your intimacy, and your confidence, go ahead and click that subscribe button and turn on notifications. That way, you won't miss the rest of this powerful series. And you'll be joining thousands of men who are finally giving their bodies the care and respect they've always deserved. Take a deep breath. We're just getting started. Hi again, I'm Dr. Michael Bennett. Today's mistake is one of the most overlooked and one of the most damaging in the long run. Not because it hurts the body quickly, but because it slowly disconnects you from yourself. It's what happens when you treat masturbation like a mindless habit. Now, what do I mean by that? I mean the kind of sessions that feel automatic, no thought, no presence. Just something you do to fall asleep, or to relieve boredom, or because you've always done it that way. There's no intention, no awareness, no connection to what your body is actually feeling. And here's the truth I've learned after more than 6 decades of working with men. When you stop listening to your body, you start losing it. I've had men in their 60s and 70s tell me, Doc, I don't feel much anymore. When I ask them how they touch themselves, it's usually rushed, repetitive, disconnected. It's not that their bodies are broken. It's that their relationship with their body has grown numb. And that disconnection creates a ripple effect. You stop noticing subtle signs of irritation or injury. You ignore early warnings from your prostate or nerves. You push through moments that need gentleness with force. You stop feeling the natural rhythm that used to keep your sexual energy alive. Think about this. When's the last time you slowed down, breathed deeply, and actually felt your body during self-pleasure? When's the last time you made it a moment of care instead of a quick release? You see, after 60, masturbation is no longer just about release. It's about maintenance, restoration, healing. Your penis, like every other part of your body, needs attention to stay healthy. And just like walking or stretching or meditating, mindful self-touch can improve blood flow, reduce stress, and support your nervous system, but only if you treat it with the same care. So how do you shift out of the habit loop? Start with these. Set an intention. Don't just get it over with. Give yourself permission to slow down. Create a calm space. No rush, no distractions, just you and your body. Breathe. Yes, breathe deeply. Let your breath guide your rhythm. Touch with curiosity. Explore. Feel. Notice how your body responds. This might feel awkward at first. That's okay. Most men have never been taught that their sexuality is something to connect with, not conquer. But the men who make this shift, who stop treating masturbation like a chore and start treating it like a form of self-care, they often report more sensation, better erections, and even greater confidence. So if this hit home for you, take a moment. Ask yourself, am I present with my own body or just going through the motions? You deserve more than a routine. You deserve real connection, even in your most private moments. In the next part, we'll talk about one of the most underappreciated aspects of sexual health after 60, caring for yourself after climax. And trust me, it matters more than you think. Hi again, I'm Dr. Michael Bennett. Let's talk about something that almost no one talks about. Not in locker rooms, not in doctor's offices, not even in most sexual health guides. And yet, it's something that makes a big difference as you age, taking care of your penis after climax. Yes, what you do after ejaculation matters. A lot more than you might think. Most men finish and move on. We zip up, we wipe off, maybe we drift off to sleep. And for decades, that might have been fine. But after 60, your body becomes more vulnerable to irritation, inflammation, and even infection. The skin doesn't recover as fast. The tissues need more care. So when you don't tend to your body after climax, you might be quietly setting the stage for long-term issues. Let me give you an example. I had a 68-year-old patient who came in with recurring redness and discomfort. He thought it was a skin allergy. Turned out, he'd been finishing and immediately pulling his underwear back on tight synthetic fabric without gently cleaning or letting his skin breathe. Over time, that simple habit caused irritation, blocked pores, and even slight tissue swelling. Now, is this life-threatening? Of course not. But does it affect comfort, sensitivity, and confidence? Absolutely. See, after orgasm, your genital area is in a highly sensitive state. There's increased blood flow, mild swelling, and your skin can remain slightly open or exposed for several minutes. During that window, friction, bacteria, and pressure from tight clothing can do more damage than you'd expect. Here's what I recommend instead. Clean gently. Use warm water or a soft, damp cloth. No harsh soaps. Let it breathe. If possible, stay nude or wear loose cotton boxers for at least 15 to 20 minutes. Hydrate your skin. A light, fragrance-free moisturizer can protect and soothe. Check in. Notice how you feel. Any pain, stinging, or lingering tension? That's your body speaking. And beyond the physical side, there's also emotional aftercare. This is your moment to slow down, to reflect, to treat your body not as a machine, but as a living, feeling part of who you are. Aftercare isn't just hygiene, it's respect. Respect for your skin. Respect for your aging nerves. Respect for the journey your body's taken with you. When you treat your post-climax moments as part of your health routine, not something to rush through, you reduce the risk of inflammation, and you build a more positive, grounded relationship with your sexuality. And honestly, that kind of care shows, not just in how you feel, but in how you carry yourself, how you connect with others, and how you age. If this gave you a new perspective, let me know in the comments. What's one thing you've never done after climax, but might try now? And don't forget, hit subscribe so you don't miss our next topic, the healing power of pelvic floor exercises, and how just a few minutes a day can change everything. Take care of yourself. You deserve it. Welcome back. I'm Dr. Michael Bennett. We've covered a lot of ground so far. Physical habits, emotional awareness, even your brain's response to stimulation. But today, I want to share something that's often overlooked, and yet may be the missing link in your journey to full sexual vitality. Let's talk about your pelvic floor. Now, if no one's ever mentioned this to you, you're not alone. Most men don't hear the words pelvic floor unless they're recovering from surgery or dealing with incontinence. But here's the truth. Your pelvic floor muscles are the foundation of your sexual function. They support your bladder, they control your urine flow, they help maintain erections, and they play a vital role in the intensity and control of your orgasms. Think of them like the underground support system for everything happening down there. And just like any muscle, they weaken with age, unless you train them. I've had men in their 60s and 70s come to me feeling frustrated. Their erections weren't as strong. They were leaking a little urine after they laughed or sneezed, or they felt their orgasms were dull and fleeting. After ruling out other causes, I introduced something simple: pelvic floor training. Just a few focused exercises each day. And in a matter of weeks, many of them noticed real changes: more control, stronger erections, less leakage, more sensation. So what exactly are these exercises? They're called Kegels, and no, they're not just for women. A Kegel is when you tighten the same muscles you would use to stop your urine midstream. You squeeze, hold, release. That's it. You can do them sitting, standing, lying down, even while brushing your teeth or watching TV. Start simple. Squeeze for 3 seconds, relax for 3 seconds, repeat 10 times, and do this 2 to 3 times a day. It takes less than 5 minutes, but the impact can be life-changing. Why don't more men do them? Because no one ever told them how much power they hold. These muscles connect your mind to your manhood. They help circulate blood, stabilize erections, and increase sensitivity. And best of all, they can be strengthened at any age. So if you've been doing everything right, but still feel like something's missing, this might be it. Add pelvic floor training to your routine. Treat it like brushing your teeth or taking your vitamins. It's small, it's simple, and it can support your sexual health in ways most people never talk about. And remember, you don't have to feel broken to start building strength. You just have to care enough to try. So if you've been doing everything right, but still feel like something's missing, this might be it. Add pelvic floor training to your routine. Treat it like brushing your teeth or taking your vitamins. It's small, it's simple, and it can support your sexual health in ways most people never talk about. And remember, you don't have to feel broken to start building strength. You just have to care enough to try. You've made it this far. You've shown up, you've listened. You're doing something powerful, something most men were never taught, but deeply deserve. And if you haven't already, hit that subscribe button so you can keep learning and growing with us. You're reclaiming something precious. Let's keep going. Hi, it's Dr. Michael Bennett again. And if you're still watching, if you've made it all the way through this series, I want to take a moment to say something important. Thank you. Thank you for showing up. For yourself, for your health, for your future. Because what we've talked about here isn't just about masturbation or erections or mistakes. It's about something much deeper. Your relationship with your body, your confidence, your sense of being alive. For too long, older men have been left out of the conversation when it comes to sexual health. No one tells you what changes to expect. No one teaches you how to adapt. And sadly, many men end up feeling ashamed, confused, or convinced that this is just what happens with age. But I want to leave you with a different truth. Sex doesn't end after 60. It evolves. Yes, your body changes, your skin is thinner, your circulation's slower, your recovery takes more time. But none of that means you're broken. It means you need a new approach. You've learned how to loosen your grip, use lubrication, listen to your prostate, retrain your mind, be present, not automatic, care for your body after climax, and strengthen the foundation through pelvic floor exercises. Every one of those choices adds up, not just to better sex, but to a better connection with yourself, a deeper confidence, a new kind of pleasure, one rooted not in performance, but in presence. I've worked with men in their 60s, 70s, even their 80s who felt like their sex life was over until they made just a few small shifts. And what came back wasn't just sensation or erection, it was joy, connection, dignity. So wherever you are in your journey, whether you're single or partnered, active or just getting started again, know this: you're not too late, you're not too old. You're just getting the right information, maybe for the first time in your life. And now, you have a choice. You can go back to old habits, or you can take everything you've learned and step forward, more mindful, more curious, and more connected than ever. If this series helped you in any way, if it made you feel seen, respected, or inspired, please consider doing two things. First, click subscribe and turn on notifications. That way, you won't miss the next topics we'll be covering, like natural testosterone support, better sleep, emotional intimacy, and more. Second, leave a comment below. Let me know what you've learned, what changed for you, or what you'd like to explore next. You are not alone in this, and you are not done. Take care of yourself, your body, your pleasure, your spirit. They're still worth honoring. Always.